Okay, welcome, ladies and gentlemen. I am excited to be hosting a forum tonight with a patient who has explanted from breast implant illness. We're going to be hearing her story. My name is Dr. Alicia Bhatia. If you don't already know who I am, I'm a naturopathic doctor in Southern California. And sorry, you hear possibly my dog in the background. I am excited, and Hillary, I would love to kind of hear just a little bit of background of your story. You were sharing kind of before we just started that how you even got implants in the first place.
Okay, so for me, I was very large from the age of 13 on. So I had my first reduction probably 12 years ago. And at that point in time, they said they could only take so much tissue. I was big. I was really big. And so going about 5, 6 years after that, I decided I'm still not small enough. I need to go in for another reduction. So I ended up going through my friend's doctor, which I wish I would have done my research back then, was more of a plastic surgeon than specializing in breasts and all of that. But anyways, as I was being rolled in, I will not say names, as I was being rolled into the operating room, he said, I may need, and this is my second reduction, I may need to use a small implant to keep your lift up. I didn't think anything about it and thought, okay, I don't want to be bigger, but if it's going to hold my lift up and keep it in place, I'm fine with that. And so he put in small implants. They were 200 cc's and they were supposed to be under the muscle. And I'll go into the issues later. I had them in for less than 5 years. Within the first year is when all my symptoms started. I already had thyroid issues from after I had my second child. That's when my thyroid issues started. But I genetically am prone to those through my DNA and my genetics. My whole family had it. And I was adopted and found that history out after I started going through this process. But then I started losing my hair, blurred vision. My bowel movements weren't normal, joint and muscle pain like you would not believe, skin rashes, GI issues, anxiety. I don't have anxiety. It's gone when I had it, but I don't get anxious about anything. I just have never been that person. For me, the worst was the joint pain, the joint and muscle, because I'm so active. But I had sores show up on my tongue, on the roof of my mouth. I would break out in rashes for absolutely no reason.
And these symptoms started how long after the?
Within the year.
And what year was this?
What was this?
What year would?
It was 6 years ago now.
Okay.
6 years ago now. I'd have to look at the date, but and I didn't think anything of it. I thought, oh, it's just my autoimmune issues. I've got the thyroid issue, maybe this. Then I started gaining weight. I'm not a big person. I mean, the heaviest I've ever been pregnant is 130 pounds. And I started gaining weight. I couldn't lose it. You could see it in my face. I was like swollen with inflammation. My hands were swollen. My rings didn't fit. I'm like, I was just in fatigue, brain fog. I'd walk from one room to another and couldn't remember what the heck I was looking for.
How did you first get clued in that so 5 years in, you're like, wow, all these symptoms. And then how did you get clued in of like, okay, it's not just these other diagnoses that you've been given?
I had a girlfriend who had just went through the process, and she had her breasts in, I'm going to say, for 29 years. She was way back in the day. She was a stripper in Vegas. She's not, married and all of that now, but that's why she had the implants. Well, she started sharing her stories with me, and I said, where are you getting this information from? And so she's the one who referred me to that group. And then I started digging deeper, and I'm like, oh my God, this sounds like what I have. Now, what you have to be careful with is BII mimics a lot of autoimmune diseases. A lot. It can mimic the Epstein-Barr virus. It can
Yeah,
mimic
and just
thyroid.
for the record, just so in case somebody's watching it doesn't know, BII, breast implant illness.
Yeah, breast implant illness. So it can mimic. So you have to kind of decipher and pay attention to your body and realize what's going on. I can tell you, I explanted, and within 4 hours, my daughter was driving me home, and within 4 hours, I started noticing a difference. The whites of my eyes used to be yellow; they're white now, and they were turning white as we drove home.
Wow.
My brain fog was going away. I felt better. I can't even explain how quick it happened and how much better I felt. And with the surgery itself is easy. For me, it was easy. I had absolutely no issues. I came home with drains in. I'm not sure if she had drains or not. Some doctors use drains, some don't.
Yeah. So for the people who will hopefully watch this later, who have breast implants and who think, okay, wow, so some of these symptoms are resonating. I'm thinking maybe, for themselves, they have breast implant illness. Maybe they are already in the social media groups on Facebook. What would you say to them? So, researching doctors, how did you embark on that? Did you just use your friend's
So,
doctor or?
so I joined the breast implant illness group. There's over 4.4 100,000 people on it. There is a list of doctors on there that specialize in the end block, the explant, everything that's done with it. I needed to have my ribs scraped because part of the capsule was attached to my ribs. So he had to make sure because if you leave a little piece of that silicone in your body, you are going to continue to have the same reactions. It's the silicone that causes it. So we took that out, but then my chest muscle was detached also because the implant was not put in correctly in the beginning. So he had to repair all of that. But when you have your surgery, it's an easy process. I mean, I went home with my daughter. The hardest part for me, and I think for most, is you cannot use your arms. They tell you, they know it's longer than 5 days, but they don't want you like getting up out of bed. You cannot use your arms. I suggest, and I used a wedge pillow at night or anytime I was laying down that would keep me elevated. And I used a pregnancy pillow when I was sitting watching TV to keep my arms on my chest and flat. But I needed somebody. I lived by myself. I had somebody there for 5 days. After that, if I needed help, my girlfriend who had the surgery would come over and wash my hair. My neighbor would bring me food. And then when you go back, I had my surgery on a Wednesday. My recheck was on a Friday. I was still draining too much. So I went home for the weekend with the drains. They are not painful, not at all. And went back Monday. He was able to take the drains out. Honestly, he had me lift my arms up and they were out. I didn't even feel it. It was incredible.
That's awesome. So you were starting to feel better after 4 hours, but when, like you shared earlier today when we chatted, you've lost a significant amount of weight, an inflammation weight, you called it.
Inflammation weight, 100. I went from 124 pounds down to 107 pounds. And you can see, you can see it in my face, but I haven't seen you in a while. But I mean, my rings fit, everything fits. I've changed my diet along with this a little bit. I did my genetic testing and I cannot have gluten. I'm allergic to it.
Yeah.
So I'm prone for celiacs if I keep eating it. So I don't do gluten, sugar, dairy, or alcohol. I fast. I eat one meal a day with 2 snacks.
Wow.
So,
And you were also telling me like, so it's almost been a year since you explanted. Would you say like what was the timeline? Like, so for like your, have your EBV numbers gotten better? Have you seen lab work?
oh yeah, I've done, yeah, and I'm in the middle of doing another Genova diagnosis or test, but yeah, my numbers have changed. My EBV is barely active. No more muscle pain, no more joint pain.
And
My
that
sleep,
happened within like a month or within 3 months?
I would say every day something different was happening, but like my weight loss, I think I've lost this weight and have held at this weight for about 6 months now.
Wow. Okay.
Yeah. So it was pretty immediate when I started dropping weight. And then when I changed the diet up, the combination of having those out, and I changed everything I use to my shampoos, my soaps, my toothpaste. I got rid of all the heavy metals.
Yeah.
I changed everything.
Yeah. That's awesome. So, what would you say for, the woman listening to this later? Like if she's kind of she maybe as we were kind of sharing with people that we were going to do this, I got an email of, well, how do I really know? Going on an explant, we talked about, you and I earlier today, is generally you told me that only like 20, maybe 20% of it's covered by insurance, most often not covered.
Most often not, unless for some reason the implant is defective
Mm-hmm.
and has to be taken out for a defective reason. Once in a while, you'll find an insurance company out of one, maybe out of 500, that'll cover it for health reasons. Mine was not covered. It cost me close to $11,000, depending on your doctor. Um,
And just,
but I
and is that
researched.
the same price as do you know how much
No,
implant?
an implant's like $6,000.
Oh, okay.
Yeah, no, an implant. I mean, some of them are 3,500, depending on where you go. Yeah,
Okay.
yeah.
Okay. And then what was my other question? So there is no test. Like no one can definitively say you have breast implant illness, but if you have a lot of these symptoms and maybe autoimmunity, can you speak to that?
Yeah, what for me was kind of a tall tale is I was following this group and I was getting heart palpitations like you would not believe at night. And I'm like, this just isn't normal. And so I was researching through that group and the documentation, and that's a big tall tale sign. Obviously, autoimmunes can do that, but not necessarily. I was getting it every night. And then I also ended up, it causes candida. And I ended up with a really bad case of candida. And I went, that's it. I need to do something. I've got to take control of this. And my mindset was, I'm going to take them out. If I get better, I'm going to know that's what it was. I don't care what I look like anymore. I want to be healthy. Yeah. And I have absolutely no regrets. I would do it again tomorrow. I have not, I'm 59 years old and I feel fabulous.
Oh, that's awesome. Well, thank you so much. I'm going to kind of wrap up this recording and then we'll stay on for a little bit more because is there anything else you want to say to the people who will watch this replay?
I would just say if you even think that you might have breast implant illness, do your research. You can get my phone number from Dr. Alicia, and I would be more than happy to talk to you in depth. And I have other people in the group that would do the exact same thing. we kind of all worked together. Everybody was passing down the surgical bras. We were passing around pillows. You know, if you need long pajamas, we were just as a group wanting to take care of people. In fact, a friend of mine is having the surgery this week.
Oh, that's awesome.
Yeah, so I got all my wedge pillows back for her.
Oh, that's awesome. I love the community support. And let's actually, one last thing. I would love for you, even though it's not related to breast implant illness, but I would love for you to share what you do with something also for our community in trauma. Can you just speak to that for just a moment? Just because I find it so awesome.
The TIP, Trauma Intervention Program. I respond to suicides, fatalities, and unattended deaths to assist families in time of need. I've got the background for that. I was on a paramedic unit for 8 years and then a police officer for 15 years. So my background's on that. I'm easily able to separate. This is not my trauma, it's their trauma, and I'm giving back to the community.
I love that. I think that's so awesome.
Yep.
Well, we're gonna stay on. I'm just gonna stop the recording because I feel like you just were able to give so much great information so fast. So thank you so much. And for you watching the replay, feel free to call our office if you do have any questions, 951-466-9339.